Welcome. I'm Michael Bolden, Managing Director of the John S. Knight Journalism Fellowships at Stanford University. Back in March, as the novel coronavirus was becoming a global crisis, I proposed to the other members of the JSK leadership team that we issue a journalism challenge for our then current class and our vast network of alumni to help provide communities with better news and information about the pandemic. It was a collaboration from the beginning. Our director, Don Garcia, found money to fund it, and Don and my fellow managing director, Pam Maples, helped refine and launch the idea. Our associate director for post-fellowship programming, Georgie Pajeski, developed a selection process, and in the end, we awarded 5 projects a total of $123,000, thanks to existing funding we had from the John S. and James L. Knight Foundation. We were delighted to see visual submissions, and we chose the best one, Artists Against an Infodemic. Media organizations Catch Light, the Everyday Projects, and Disturb are pairing health messages with visuals to document the daily impact of COVID-19. Today, we hope to show you how the team is leveraging viral tactics and public displays to inform underserved communities around the world. Let's take a look at one example of the work.
Hi, my name is Kiana Hayeri and I'm a photographer based out of Kabul, Afghanistan. My image shows a young woman inside Herat's dedicated hospital for COVID-19 patients, which is on the outskirts of the city in northwest of Afghanistan. The photo conveys a sense of isolation, which has been the case for many of the patients here. There is a huge stigma associated with testing positive for coronavirus, to the point that many people refuse to go to clinics or hospitals to get tested, or once they're tested positive, they hide that from their relatives or people around them. How coronavirus first arrived here in Afghanistan was through illegal migrants working in Iran, the day jobs, labor work, and they were crossing on foot back into Afghanistan fleeing the pandemic. Little they knew, many of them were carrying the virus with them. Ever since then, there has been a lot of victim blaming of those returnees from Iran, which has forced them into isolation. Many of them haven't lived here in Afghanistan for years, decades. Many of them had children born and raised in Iran, and now they're forced back into their homeland, yet isolated from their communities.
Oh, that's terrific. Let's talk about it. The members of the core team include 5 people. 3 of them are with us today. We have Peter DeCampo, co-founder of the Everyday Projects and a member of the JSK class of 2019. We have Elodie Mayat Storm, CEO of Catch Light and a member of the JSK class of 2017, and Benjamin Petit, co-founder and director of Disturb and a member of the JSK class of 2019. The team also includes Pamela Chen, a digital strategist and a member of the JSK class of 2020, and Dr. Janelle Stewart, an infectious disease and public health specialist and a 2019 JSK affiliate. So let's begin. Why is it important to have a visual initiative to fight misinformation about COVID? Let's throw that out to our panel.
Who wants to start? Well, I mean, I think for us, we all come from a photojournalism background. We all, understand the power of documentary photography, of photojournalism to make these issues real. And especially for a project that's talking about misinformation, disinformation, and for a problem, a pandemic that is global in its scope, we really wanted to bring images of how this was affecting people, is still affecting people worldwide, and bring them into these public spaces and bring them into social media in a way that we hoped made this a more real issue, a more pertinent issue. I mean, the number of people just in my own life who I've heard say, I don't know anyone who has it, so are these numbers real? And so documentary photography helps to say, well, you may not know anyone who has it, but here are people who do, or here are people who are, trying to deal with it in the same way that we might be in, wherever we are. The quarantine, the isolation, that's been global. And then at the same time, something that the 3 of us have less immediate experience with, I think, but something that we have a great amount of respect for is the sort of illustration and other forms of visual media that we used in this project. I mean, healthcare messaging historically is often done through illustration. And so pairing those two things, the documentary photography to make it real and the illustrations that conveyed specific healthcare messages, we thought would be very effective.
So how did you all get to that point, though? How did you decide that your three organizations, along with Pamela and Dr. Janelle Stewart, who is, of course, Peter, your wife, how did you decide to put together this collaboration to sort of tackle this problem?
I'm happy to take that question. I think what was actually amazing is that it kind of stemmed from the call that you put out, Michael. And once we saw the call coming out from the GSK fellowship at Stanford, having had experiences working with both Disturb and the Everyday Projects, we got together on a call really quickly and said, what an incredible opportunity to really make a difference. And I think each of our organizations were trying to figure out how do we help information get to communities that need it. And so we started brainstorming, and the idea came together very, very quickly after that.
That's great. And this is for all of you. What strengths do you think each of your organizations bring to this collaboration?
I can start. I think, it was a great collaboration to work on. I run Disturb. What we do is mostly installation in public spaces of news-based art installation. So we've been doing that for years and years. And really what we are trying to do is to reach people who don't necessarily read, watch, or listen to the news. So it was very interesting for us to partner with the Everyday Project and with Flashlight and use all of our strengths. Every day I've and Peter can talk about it, I've a great community online. And Flashlight has also a lot of experience into communities outreach and working with local communities. So we really use the strength of all of these assets to be the most effective we could with communities.
That's great. Peter, do you have thoughts?
Yeah. So for the Everyday Projects, we were really born as a project on Instagram, starting with Everyday Africa and then spreading to this sort of global network of everyday accounts on Instagram, Everyday Middle East, Everyday Asia, et cetera. And so our strength that we brought to the table is this global reach, but also specifically that the large social media audience that we have and our sort of expertise in trying to package things for social media for that audience. So this was a new challenge of packaging healthcare messaging, but it was something we were excited about trying out.
And Elodie, your organization, of course, is phenomenal. So, the expertise that you all bring, could you talk about that?
Yeah, so on our end, what was fascinating is to think about it really in terms of what information do communities need, and making sure that we engage communities in this process in a way that's very deep. So, for example, we leveraged the ties that our various local fellows we have. Catchlight has several fellows working in various communities in the Bay Area, and so we leveraged the community relations that these fellows have to understand what information needs these communities have. So for example, Jessica Prado, and maybe we can go to her work, is one of our fellows working in the Bay Area with unhoused communities. She herself is living out of her RV. And so she had a really great understanding of what do people who do live out of their vehicles or in RVs in Berkeley and San Francisco, how has their life changed, and what information do they need to keep themselves safe? Knowing, for example, that they had lost access to the internet that they used to get from going to cafes, for example, when everything shut down. So we worked here with Disturb and Everyday on figuring out what information do do we need to put together, and how do we go and distribute it in a way that's visual and easy and enticing for people to access. So we ended up actually doing small posters and flyers that she went to distribute windshield by windshield.
Great. So, I mean, speaking to that sort of working in place, how do you decide where you're going to disseminate your visual content? I mean, this is a global effort, and you're doing things that are incredible around the world. I mean, you know, part of it is, I guess, because of relationships. But let's delve into that a little bit. How do you tackle what cities and what communities?
I can talk about, like, on this top end, what we usually do is, like, we use the vast community of visual storytellers around the world. And they not only pitch stories to us for Disturb to feature, but they also inform us on who are the actors at play locally, and that we should have a dialogue with and collaborate, and we design and produce activation in a specific country, city, and neighborhood. So it's kind of a two-way street with the storytellers on the field to know where to act. And here for this specific campaign, it was also informed by where our organization are located, and also by, for example, in New York, where I'm based, it was informed by which neighborhoods and areas where people maybe don't wear masks or where COVID-19 infected the most people. So we kind of take in account all of this information and the social profile of the neighborhood to choose where we're going to install those activations.
Okay.
I think one of the things that we looked at too, obviously, is, you know, where is information the most needed. And so, for example, here in the Bay Area, we had the city of Livingston, which is in the Central Valley, reach out to us saying, we really want to have this health campaign come to us because we have a lot of farm workers or industry workers that are getting infected, might not have access to information, and making them, you know, understand that this town is part of a broader context, and that what is happening there is happening everywhere. And so that's something that they thought was really valuable, is putting the context of this crisis in a global perspective.
So, Elodie, just to follow up on that, so in a situation like that, where you're dealing with agricultural workers, I mean, there are probably questions of access and that sort of thing. Just sort of walk us through some of the decision-making that has to go into deciding what's going to be the most effective way to deliver a campaign in that community that's going to reach the people who need to hear the information you're delivering.
Yeah, so in this case, we worked with the city of Livingston in choosing the location of where the poster, first of all, which poster, and they decided to go with the mariachi poster that we put together. So the question was, which poster, where does it go? And so they made sure that it was in a park and in a community place that people would gather at night and have everyone run around. I mean, obviously it's a safe public space, but it's a space that's used for people to run and exercise and just relax. So that was a part of it. And then also using some of the website and the Facebook pages that the city has to also put the messages there and share them there in a way that was directed in a fun and engaging way at the community.
Great. So, Peter, the everyday projects, I mean, you all started on Instagram. I mean, so social, of course, is part of all of your efforts, but it's really baked into the everyday projects. Could you talk briefly about, that as a platform for this, and how you all use that to be more effective and to reach more people?
Yeah, absolutely. It was really interesting. The everyday projects really are about sharing documentary photography, for the most part, photography made by photographers from that region, whether it's Everyday Africa or others. And so this was a new challenge for us to think about, healthcare messages, and especially because the project included illustration as well as photography. So it was, it was easy enough to sort of post the imagery and post the healthcare messages, and Disturb made some really great content that the videos like the one that you saw in the beginning, etc. But we also wanted to go a little bit beyond that and really make sure that we were engaging with our audience, especially because we were trying visuals that were very new. One thing that we did that we thought was really interesting and successful was that my colleague who runs Everyday Africa, Washera Njagi, who's in Nairobi, she put together quizzes using the content and then doing, Instagram's functionality for, usually people do it for like a, should I do this today? Yes or no kind of thing. But we did it with COVID-19 facts and information. And for the most part, people would answer those questions 99% correctly. One thing that was really interesting is that for the question of, I forget exactly how it was framed, but the question of your mask protects you or your mask protects the people around you, which of course the answer is that, the masks really are about, kind of catching your own droplets and thus protecting the people around you. But about 1/5 of the audience answered that incorrectly. So about 20% of the respondents. And then, we would follow each slide by the correct answer and the hope that it sort of taught people. So I'm really hoping that those 20%, which was hundreds of people who answered it saying, no, my mask protects me, I'm really hoping that now they learned actually it protects, the people around you. So, yeah.
That's fantastic. One of the things that I've seen that's been very interesting is seeing how people who are combating misinformation and trying to provide accurate information adapt to what's happening in real time. I mean, 2020 has been a remarkable year in all kinds of respects. And events have, even in the middle of the pandemic, we've had just incredible things happen, such as the reckoning with racial justice. And I'd like to show an example of how you all sort of adjusted the campaign, and then let's talk about it.
Hi, my name is Tyler Cuckoo Jr., and I'm a photographer and artist based in Washington, D.C. In the aftermath of George Floyd's death, I decided to take it upon myself to go into our nation's capital and to start photographing some of the unrest and the protests. On this one particular day, I came across Jamal on our walk on Black Lives Matter Plaza. He was carrying his daughter on his arms, and there was just something so striking about that picture. We were here marching for George Floyd, marching for Breonna Taylor, and he had his young daughter with him. I decided, this would be a good shot to take. And once I took that shot, I realized that there was more to this story. I asked Jamal what brought him out there this day, and he told me that it was his daughter. He was marching for her, that he could not sit and stand by in a country that was failing its citizens, its Black citizens, and most importantly, its African American women. And that since he was trying to raise an African American woman to be strong, he needed to be strong for her and to stand up for what he wanted the world to respect her and to show her and his daughter when she grew up. All in all, it was just a very poignant moment, and I'm just glad that I was able to not only take that picture, but connect with someone else and find out the reason why they were marching.
Being able to sort of respond to things that are happening on the ground, even in the midst of a crisis, I think just shows tremendous dedication on the part of this team that you all have put together. Let's talk about that process and how you are able to sort of maintain that flexibility. Peter, what thoughts do you have on this?
Yeah, for anyone working in this field or on this topic, or really for anyone alive in 2020. It's just been a year of constant pivoting and constant rethinking, and we were in the midst of being able to launch the initial round of artwork and public health messaging, and then George Floyd was murdered, and this sort of reckoning began, or not began, but intensified, I should say, because as we know, I mean, really, for us, we are considering racism to be another public health crisis, and so we knew that we had to incorporate it in some way. We knew that we had to bring in further messaging that went beyond COVID and specifically addressed the inequities of racial injustice, and how that, is another layer on COVID, that disproportionate numbers of Black Americans have died from the COVID-19 pandemic. And so, it was really a sort of scramble to incorporate Black artists, incorporate more artwork that spoke to these issues, find the right messaging that we were all comfortable with, and just get it out there as fast as possible. So it was head spinning, but I'm really proud of the way that the whole group, was reactive and responsive. So,
Elodie, I see you nodding in agreement. Would you have thoughts you'd like to share?
Yeah, I mean, I think this was a moment, and this whole campaign has been a moment, and we talked about that a lot as a team, of like feeling the emergency of wanting to inform people and get messages out as quickly as possible, and then yet do it in a way that's thoughtful. And we're talking about, not just digital messages, but also having to go and paste really big public pieces. And so it was sort of this constant tension between the sense of emergency, but yet wanting to be really thoughtful and doing things in a way that's hyper collaborative, not just between us, but also with the communities that we engaged with and the artists that we engaged with. And so the tension was real, but as Peter said, like, so happy with the outcome, and also so happy that we stuck with it, and that we didn't let time and the sense of emergency make us rush things, because in the end, the messages that we started with around mask wearing, if you think about it, are still, and if not more, relevant today than they were then, but it wasn't as obvious when we started, if that makes sense.
That's great. I mean, and one of the things we saw there, of course, was one of the giant paste ups. And I guess I think of Disturbed as being sort of the king of the paste up messaging. So Benjamin, I mean, I guess you all have that down to a sort of science now when you want to deliver these messages. Could you talk about being responsive and delivering that?
Sure. I mean, it's science that we're still perfecting, and this collaboration was a great opportunity to actually think more about our way of working. And I'm learned so much personally, because, I mean, with Disturb, we're kind of used actually to kind of react quickly and design posters with information, contextualizing caption, and put them over the street reacting to our news. So here it was so important and so great, thanks to that collaboration, to take a step back, to think a bit more about the why, the what, where, how the communities would respond to it. So it was like a great appreciation. And then for the design part, yes, we've been designing news-based posters for the last 4 or 5 years, and it's been evolving all along the way, and during my fellowship at Stanford as well. And during this process, it was something new for us to pair like that illustration with health messaging and visuals. And I'm very happy with the result, and I'm sure it could be still improved, and we can still work on it, but we definitely learned a lot.
Great. One of the things that I find kind of amazing is that there are so many different partners who have to come together to make this happen. Of course, we've got the collaboration among you guys, but there are communities involved. I mean, Elodie cited the Livingston example. I know you issued a call for visual journalists to also help. So there are all these different partners at different levels that have to come together. How do you make that work? And Elodie, if you could possibly start with an answer to that.
Yeah, I'm happy to do that. I mean, I think that's something that's built into the Catchlight DNA collaboration, is at the center of what we do, because we know that we can't help the field without bringing everyone together. In the case of the Bay Area, which is one of the geographies that we worked in a little bit more deeply on our end, we looked at what community partners can really help us get the information again to the people that need it. So again, going back to the example of Jessica Prado, but we also worked with the Mission Food Hub in San Francisco, which is an organization, nonprofit organization, that not only provides food for people that are being affected economically right now in the mission, but also was doing COVID testing. And so to them, I think it was really important, again, to place art as a source of inspiration and context to the work that they're doing, helping the community on a daily basis. And for them, actually, in talking with them a lot more, and Erica on our team took the lead on that, but they are doing these pop-up sort of health festivals around the city. And for them, they wanted to have a type of installation that they could take along. And so we ended up printing for them on banners so that they could take that information with them, like wherever they were going. So not only did we do paste ups, but we ended up doing banners.
Great. And I know, Benjamin, I've seen some of your pastes up in cities, Paris, in the Mid-Atlantic, in New York. I mean, sometimes I guess you work with museums. How do you convince people to let you use their buildings as a billboard, essentially?
Yeah, I mean, mostly by showing them the work and explaining them what we do and what's the messaging, what's the goal. You would be surprised by how many people, owners or coffee shop, restaurant have allowed us to paste there. And it was interesting because by pasting in areas where usually you don't have advertisements or something else, you really create an element of surprise for the passerby. And also we choose carefully our locations so that people are kind of hanging around. It's not just high traffic avenues with cars and everything, but it's really areas where passerbys are going to pass by and also stay either at the terrace or the square or something like that. So for us, it's really important to get
Great. And I know, Peter, especially with the work that you've done in Africa, you're continually trying to find partners. I know you're concerned about authenticity and actually putting, the right people to work, in communities. Can you talk about your experience doing that?
Sure. What was really important for me on this, especially with this project and the paste ups we ended up doing in Nairobi, is that we had, her name's Washera Njagi. She's our Everyday Africa coordinator, and she's based in Nairobi. I am also supposed to be based in Nairobi, but the pandemic had other plans for Janelle and I this year. So Washera has these on the ground contacts, and then specifically, there was an artist that applied for this, the Artists Against an Infodemic program that, he applied saying, well, I paint murals, and unlike a lot of people who submitted sort of digital artwork, he just had already painted some murals, submitted pictures to us of what those murals looked like. And we essentially ended up sort of saying, okay, we'll use your sort of prize money to commission a new mural. So he went out, painted new murals, and this is in the Mathare slum in Nairobi, where he lives, where he is a known artist, where he works. People see him out there and they pay attention to him. So not only did he paint his own murals, but he also, Washero went out with the Disturbed pay stubs, and the two of them, incorporated those pay stubs into his paintings, which I think was, maybe is not something that would work everywhere, but for that community being familiar with his style, I think, it's a matter of tailoring the message to the audience.
Yeah. One of the things with all of these different communities, we sometimes live and die today by metrics, right? I mean, because funders want to see the data, you want to know what your reach is, that sort of thing. When you're dealing with this, I mean, right, if you're dealing with a social media platform such as Instagram, you can say, okay, we had this many people like this or whatever. But what metrics are you all using overall to track the effectiveness of your campaigns?
For the public space here, I mean, obviously, as you mentioned, we track data and metrics on our social media, on Disturb, on the website, and we all do. But for the street, honestly, we focus way more on qualitative metrics, either doing surveys or interviews and testimonies to see how people react to our installations. It can be while we're installing them that you see like so many passerbys like interrupting us and we have to explain what we're doing. And also afterward during the live of the installation, which can go from a few days to several months. And we also produce documentation around all of these installations to then spread them on digital social media. So we're also sometimes able to track the conversion from offline to online, either using texting service or QR codes. It kind of all depends about where we're doing those installations, what's the technology available, and who is the community.
Great. Other thoughts on measuring effectiveness? So,
yeah, I mean, I think on our end, it was really important to get some qualitative data. And so what we ended up doing in a lot of the places where we did put pay stubs is go back out, because, a lot of people kind of gather around or stop and look when you're pasting, because it's kind of unusual to see people pasting. But we end up going back out, a few days or a few weeks after we pasted, or we distributed information to interview people about, how does that work, speak to you, and what else would you like to see?
Great. Peter, of course, I mean, you all must be acquiring reams of data, I mean, based on social platforms. So do you just track the likes? I mean, what do you consider a proper measure of an effective campaign?
Yeah, I mean, that's a great question because, tracking likes and interactions and views, I mean, that's all very easy. And, we know that tens of thousands of people have seen this work, and that's wonderful. Of course, the hardest thing to know is, did it teach people something they didn't already know? Did it change their opinion? Did it, sort of affect their information, their idea of information around the pandemic? And that's a lot harder to know. I think some of the quiz results are the closest we have to knowing that. But I just find myself wishing I could, reach through the screen and ask people, did this change your mind? But, something to think about for the future.
Yeah. So, at this point, we're several months into this project. I mean, and you all have learned, I would imagine, just reams of things. I'm curious to hear from each of you about what you would do differently if you were to launch this today. I mean, of course, we have a pandemic going on, so you can continue to refine. But what would you do differently? Elodie, thoughts?
Yeah, I think involving the communities, which we didn't have as much time to do initially when we wanted to get information out quickly because we were in such a rush and an emergency situation. I think now really looking at listening to the community and adapting the messages community by community, and also understanding, getting a baseline, which is something that we're now looking at doing with 2 other partnerships, around what information is there in a community and what's completely misunderstood, and making sure that we address those messages. So essentially refining the messages by audience and communities.
Great. Benjamin, what do you think? What would you do differently?
Not much, to be honest. I think one of the aspects, but it's more about the Disturb design that I would have loved to improve and to do better, was to build more site-specific installations. When we have time, and as Elodie mentioned, to work with local communities ahead of time to secure location where we're going to do our installations, it's so much better and visually more effective and more disrupting to do site-specific installation in terms of size, in terms of our installation adapts better with the urban landscape, and that really I would love to do. But I mean, this campaign is not over, so I really hope that we will get the chance to get to that eventually.
Great, thank you. And Peter, what would you do differently?
Yeah, I mean, just piggybacking a little bit off of Ben, I think one thing that was really interesting for us, what is so great about Disturb and their mission, if Ben doesn't mind me trying to, put it in my own words a little bit, is, usually their mission is to bring international media international news to audiences that, are far away from there in Paris or in the US, et cetera, and to sort of fill that gap of like, people are not reading, about international news as much. And that's a wonderful mission. What's interesting about doing that with public health campaigns is that we found that communities wanted to see themselves in the messaging more. And that while that's not a normal part of Disturb's mission, I do think that it would be interesting in the same way that Ben's talking about doing site-specific things. It would also be interesting to consider that as far as, showing people perhaps side by side how COVID is affecting the world internationally, and how is perhaps using local photos or local artwork to show how it's affecting their sort of neighbors in a sense. So.
Great, thank you. I guess our final question. JSK helped launch the project, but the pandemic isn't over. I mean, we're probably going to be in this for another year, as horrible as that might seem. Benjamin, you said that the campaign is ongoing. So when does it end, or does it end? Do you see adapting this for other crises? Is this something that will be a continuing part of your work? What do you all think? Elodie?
Elodie, please go ahead.
No, I think for us, it's very much ongoing. I mean, we've learned so much through this process, and I think we're trying to refine it. So there's a couple of things. We have, through a partnership also with Photo Wings, gotten a little bit more funds to be able to share some of their learnings and put an education component to this. And we're still pushing the envelope. We've engaged with an AI company to do some social listening, potentially in Douglas, Arizona, and discussing with Spaceship Media. Can we start this process a little bit differently next time and start with social listening, understand where the misinformation lies, and adapt it? So I think for us, this was like the beginning of a momentum and a practice that will continue on, and we're definitely taking all the learnings into other ways to inform communities, either about health crisis or other necessary information, really.
Okay, and Benjamin, my apologies for cutting you off. Please give us your thoughts.
No problem. No, but totally agreeing with Elodie. Definitely, we will continue to diffuse, to disseminate this information either on digital platform or offline. And the great thing that Elodie touched base on is also that our free organization actually have a strong foothold into education. So we've already integrated some of this content into our educational programming. Actually, as we're speaking, I know that Disturb is giving lecture to high school in Tampa, Florida, using some of this content. So definitely, I think this content and this work is going to have more life.
Right. And I know, Peter, you all have had an education component as well. I guess that's one of the things that will be continuing. What other thoughts do you have on continuing this?
Well, I have the benefit of living with an infectious diseases doctor, so I am hearing about the new, whatever the new healthcare messaging is, on a daily basis. And so, just thinking about it a lot. I mean, it was actually suggested to me by one of the community members in Wapato, Washington, which is one of the places Janelle and I pasted our mural, that we, now we should really be moving this onto college campuses and getting the art students to paste things up, and that would be the next round of places. I mean, there's just what you said, Michael, earlier, that we're not out of the woods yet on this pandemic, and so there's room to adapt it to new audiences, new physical places, and just sort of looking at where is the next place that it's moving to.
Well, speaking for my colleagues at JSK, I have to say we're tremendously proud of this work, and we thank each of you for the efforts you're putting forth to help inform people about the pandemic, but also to keep visual journalism alive in a very meaningful way that helps improve our communities. Thank you, Peter. Thank you, Elodie. Thank you, Benjamin. And thank you for being with us.
Thanks so much, Michael.
Thank you so much.
Thank you.